Welcome to the Anatomy Dissection Laboratory for students. In this video, we will dissect the pharynx. Dr. Carlos Suarez-Quian and Joel Valensky are the authors of this presentation. Dr. Suarez-Quian is a narrator. The pharynx is a muscular tube open at its front that connects to the nasal cavity, the oral cavity, and the larynx. It is where the upper respiratory way and alimentary canal intermingle, and the reason we run the risk of choking. Let's start the dissection of the pharynx. Previously, we dissected the nasal cavity and mentioned that the choana leads to the nasopharynx. Let's label a few structures now to get oriented. We again see the nasal septum, the choana, the posterior opening of the nasal cavity into the nasopharynx, the base of the skull, formed by the body of the sphenoid bone. And remember what is located there? The pharyngeal tonsils. Finally, we label the hard palate and the uvula. At this point, in the previous dissection, we removed the nasal septum and exposed the nasal conchae. And note how small the superior concha is in this cadaver. Removing the nasal septum allowed us to clearly identify the opening of the auditory tube and the torus tubarious, the elevation of cartilage guarding the opening of the auditory tube. Next, we remove the concha and expose the maxillary sinus, and crack the perpendicular plate of the palatine bone and expose the greater and lesser palatine nerves and their accompanying vessels. The dissection now requires that we cut away the torus tubarious using a scalpel and discard the torus tubarious. Removal of the torus tubarious and the opening of the auditory tube now reveals a levator veli palatini that inserts into the uvula. At this point, the levator veli palatini needs to be detached from the uvula using a scalpel and reflected superiorly. And with the levator veli palatini reflected, the tensor veli palatini makes its appearance. Realize that the part we see of the tensor is a vertical component of the muscle. The muscle also has a tendinous horizontal portion that hooks around the pterygoid hamulus and uses this bony prominence as a fulcrum to gain advantage when we need to tense our soft palate to allow swallowing to proceed. During swallowing, the uvula is tilted backwards to help with closure of the choana. We now move to a different cadaver to explore the oropharynx. As before, let's start by labeling structures and regions we're already familiar with. The tongue, the hard palate and the soft palate, the uvula, the oropharynx, and the epiglottis. Now, let's focus our attention on the oropharynx. And here we see the oropharynx up close. Although difficult to demonstrate in the cadaver, in reality, there are two elevations, or arches, that arise from the palate. The anterior one, between the palate and the tongue, is called the palatoglossal arch. And the one located posteriorly is called the palatopharyngeal fold, or arch. The arches appear sunken in the cadaver, but are truly quite prominent in the living and easy to see. And in between the two arches is the tonsillar bed. palatine tonsils involute during teen years and rarely if ever present in cadavers. The dissection now continues by using a scalpel blade and carefully removing the tonsillar bed mucosa to expose the underlying muscles responsible for the arches. First, we see the palatoglossal muscle, the only muscle that moves the tongue, but it's not innervated by the hypoglossal nerve, and then the palatopharyngeal. We also now can see a slender muscle entering the posterior aspect of the tongue. This is the styloglossus muscle. We can also see the glossopharyngeal nerve, cranial nerve 9, which provides general sensory and taste sensation to the posterior one-third of the tongue. Looking at a different dissection from a different perspective, we can again identify the palatoglossal and palatopharyngeal arches, the styloglossus, and the glossopharyngeal nerve. This now concludes the dissection of the pharynx.